Good last count, Corla. I'd like to thank Sinn Féin for allowing us the opportunity to debate further again the issues in our health service, which at this stage are legion and many. And Ministers, I think it is very worrying now the planned funding freeze into the HSE. And I'm inclined to agree with my esteemed colleague here beside me. It is probably the rationale. I think the government is trying to put some manners on runaway HSE budgets. And I think there can be no doubt anybody who has spent any time working in the healthcare or around the healthcare industry knows that we have a lot of inefficiencies and it leads to a lot of waste, a lot of needless waste. And I think that is something that is yet to be tackled. And it's something that we really have to pay particular attention to. But I do worry about the message, as Deputy Canny has said, the message to workers, the message to patients and the message to families and to those who are on long-term waiting lists. And I think we are potentially causing people needless anxiety. And I would point out, and I have said in this House before and recently enough, that we have a large number of no-shows that come into for planned elective work in the hospitals for whatever reason. And it runs anywhere from about 15 to 30%. And if we could try and create an initiative around that, we would certainly manage to bite deeper and faster into the very extensive waiting lists we have around the country and not spend a whole lot more money. Can I also just speak about the problems of unstructured downsizing, which is basically where you take one metric and you apply it to all hospitals in the acute hospital space particularly. And Minister Butler, you would remember around 2012 the government created a cost-cutting measure on all hospitals in the country. And University Hospital Waterford was the only Model 4 in the country that was under budget at the time. Other hospitals, one in Dublin, was over 20% over, and everybody took a 7% cut of their budget at that time, and we were penalised because we didn't overspend. But I think the problem here again is that if you cut in a broad measure there and it's non-selective and it's not targeted, you are going to affect the hospitals who are lower down the food chain, and particularly hospitals like ourselves and Limerick are going to suffer the most in terms of the Model 4 configuration. The Minister spoke about his productivity platform, or maybe it's a department initiative, and about rewarding efficiency. And I have said in this House many times, and I'll speak about the acute Model 4 in Waterford again, the most efficient emergency department in the country, the most efficient in terms of trolley count. And when it came to doling out €650 million of capital spend this year for the 9 Model 4s, it was given to the other 8, and University Hospital Waterford got nothing. Despite the fact that we have a pending permission secured for laboratory build and for a vertical overhead, and Minister, you and I were on calls over a year ago when these were being discussed and we were told they were approved, and yet they didn't get done. We were told about an additional bed block which looks to be gone now, along with the additional emergency beds. And as I pointed out to the Taoiseach this morning, we have 2 ED approved consultants since last March sitting with South West Hospital Group that have not been approved, have not been sent on to the CAAC. And why is that? And so we're telling people on the one hand, you're great and you're doing a great job and clap you on the back and we want to reward you. And on the other hand, there's no sign of that reward coming. And one other point, Minister, I made, as you're probably aware, Waterford incurred significant patient charges, consumables for the closure of Wexford ED. To my understanding, there has been no payment from Ireland East Group yet to reimburse our operations budget. And finally, can I just speak to digitisation? And a number of years ago, I met a company, I did some work with a company, very successful in digital health, right across America and Western Europe. And they're an Irish-based company. And I asked the gentleman concerned why he wasn't looking at Ireland, and he said, I had 2 reps on the road for 2 years in Ireland. He said, we got loads of meetings, we got loads of positive reaction, but we didn't sell a single system. So we just got out and we gave it up. And Enterprise Ireland are still bringing that company around, introducing them to foreign customers in exposés throughout Europe. And they still haven't sold into Ireland because we're not able to do it. And I would say what gets measured gets managed. Now, Deputy Robert Troy, Deputy Dennis Naughton and myself are bringing in an expert group on digitisation into the AV room in November. I would encourage anybody here to come along and hear what has to be said. And this is how potentially we might supercharge our health system, that we might introduce the real measurement efficiencies that are going to drive future service plans, because until we do that, we're going to keep going around in circles. As I say, we are not going to manage because we cannot measure, and we are going to hurt the systems who, at this moment in time, are the most efficient and are the ones that need support and are not getting it.